I would always have Dr. Charles every Thursday to talk about health, right? Health related issues. All right. Dr. Charles, say hello to everyone.
Morning. Hello, everybody.
Good. Don't forget that I asked you to send the messages that we didn't treat last week. All of the messages we couldn't treat just last week. Maybe you sent a message and then we didn't do anything about it. We did it and I didn't read it out. Please, you can forward it now. Just forward it now so we can have you just get answers to your questions. Okay, yeah, please do that immediately. The WhatsApp number again is 081 717 56338. 081 717 56338. Okay. And I recall last week we were talking about breast cancer. We spoke so much, but doctor was able to, dwell on. We delve into breast cancer, and we were able to understand this, so much about breast cancer. And if someone who's got breast cancer, please let the person go out immediately, to the hospital, for a checkup. But before we continue, I just want doctor to just dwell on it a little. All right, just a little pam here and there, and we're just good to go. Okay. Let's. Okay, Dr. Isugi is really trying to tell me something right here, and I think I would want him to say something as regards these. I want to also talk about want to talk about fertility today. All right, fertility today, and all of that issue, that has to do with fertility. But then just a little bit of breast cancer. Let's just wrap up that. Let's just keep that away, and then we continue breast cancer before we hit the main thing. Though we have just a very short time today, but let's see how we can manage that. Talk to us, doctor.
And just like we spoke about last week, breast cancer is still something that is ravaging a lot of women, and it's not anything that has any choice for race. It affects people of all races. So basically, it's cancer that develops in the breast, and ultimately it spreads beyond the breast to other vital organs. It could spread to the lungs, to the liver, to the brain, and ultimately causing the death of the individual. So it's very important that we understand that breast cancer is a very common malignancy in women, and there are a lot of risk factors that are attributable to them. And we mentioned some of the risk factors last week. We mentioned genetics. We mentioned that if you have a mother, a grandmother, an auntie who has had similar conditions, your risk of it increases. We've also mentioned obesity. We've mentioned alcoholism. We mentioned smoking. We mentioned use of oral contraceptive pills. We mentioned even the diet and lifestyle, and even some chemicals that we're exposed to all the time. There are carcinogens in some of the cosmetic products, in some of the hair dyes, and some of the things we consume and apply on our skin. So all these are potential factors that can increase a woman's risk. But it's important that women over the age of 40 go for their mammograms annually, and then the mammograms will help us know if there are any suspicious lesions in the breast that need to be further investigated. And for women who are less than 40, they should go for their breast ultrasound scan that will help them know if they have any lumps. And most importantly, it's advisable that women do what we call the self-breast examination at home, where they use the flat part of their palm to feel the 4 quadrants of the breast, know all the signs and symptoms to watch out for. If you have nipple retraction, that is a red flag. If the skin over your breast is changing, that's a red flag. If you are having any bloody or nipple discharge that is unusual, that's a red flag. All these are symptoms that you should not, just trivialize or sweep under the carpet, and seek the help of a professional.
Okay, thank you. Let's put that to rest now. If you want to ask a question, please just like I said earlier, send your message to to me right now on WhatsApp, WhatsApp 081 717 56338 081 So today we're looking at some fertility struggles, understanding male and female fertility. Now let's understand why someone will be alive and not be fertile in the first place. Like what you just showed me now, I'm shocked. The first time I'm seeing that, I'm even seeing that at all. It's crazy. Why?
We can't overemphasize, topics like fertility, because fertility is something that affects a lot of people.
And this will be part one, everyone. Next Thursday we'll continue. Yeah.
Fertility is something that affects people. If it's not affecting somebody listening to us, it's affecting somebody that somebody knows. So it's always in the picture somewhere. You always know somebody who is dealing with fertility issues. For some people, they are unable to achieve pregnancy at all in the first instance. Some people may even have the first pregnancy, but they need other children. They can't, they are not able to produce other children. So there are many factors. Like we mentioned before, there are male factors and female factors. And these factors are, they are responsible for whether a couple is able to achieve pregnancy or not. But fertility is defined as the inability of the couple to achieve conception after a year of frequent normal regular intercourse.
Okay.
And because male and female factors are involved, that means both parties need to be actively engaged in the investigations. But because of the cultural and societal pressure on the woman in Africa particularly, everybody looks at the woman as the cause of the problem or the person that needs the investigation. But like the case we just discussed before the show, obviously the problem was not from the woman. The problem is from
the man.
And this is a problem that has been going on for a number of years. And the woman may be perfectly fine, or she may also have her own issues, but obviously the man has also very important issues to deal with. It has been shown, research has shown that 40% of cases of infertility are attributable to male factors. So that means that male factor problems, accounts for up to 40% of cases. So that means it's quite significant. That means our men should not live in denial and they should seek help when they should. It's always easy for the man to say, while growing up I've impregnated so many people, or I've had a child outside the wedlock before, I can't be the one that has a problem. But that's not the truth, because in reality, male factors are really, really a big deal. It's possible for a man to have infections that were improperly treated, sexually transmitted infections that were improperly treated that were also fertility. There's something we call varicocele, which has to do with tortuous dilated veins in the testes that can raise the temperature of the testes and actually cause shrinkage of the testes and affecting fertility. You can have men having mumps infection in childhood that ultimately, affects the testicles. So we can have a number of things that can affect a man's fertility, and even people that have had a groin surgery, the groin area, major procedures affecting the groin area can also affect a man's fertility. So it's very essential that men, once they are a couple, the husband must also be keen on subjecting himself to all the various investigations that are necessary, not to just rule the facts out that he doesn't have issues that needs to be sorted out. Because in some cases, when two parties that it may be the man, it may be the woman, or it may even be both of them in some instances.
Okay.
So it's very necessary to know where you direct your solutions at. So know where the problem is so that the solutions can be targeted at where the real problems are.
Is it possible for a man to have zero semen?
It is very possible.
I'm sure.
Azoospermia, yes. There's a condition called azoospermia where the man has no sperm cells at all when they ejaculate. Yes, he does ejaculate. Yes, there is something physical that is seen, as the ejaculate, or it is analyzed and looked at under the microscope so that there are no viable sperm that can actually help to achieve pregnancy in the sperm. So that happens, or in the semen rather. So they are not viable stem cells. So that's a condition that happens that a lot of people should know about, and awareness should be created about it. That it's very possible for that to happen. So if such a man is asuspermic, but yet has never presented himself for any investigation, and his wife keeps going to the hospital all the time and they keep telling her she's fine, and they can't account for why pregnancy has not been achieved, then you see that that's a problem. So it's very important that both parties, especially the men, because it's so easy for the women because of the societal pressure to present for investigation, but the men, because of our culture and the ego of a man, they deny that they have such problems, or they may delay, in presentation, and this ultimately affects, the rate at which they achieve the conception they need. Because the moment you know what the problem is, then you can now go for what we call assisted fertilization, assisted reproduction. That is where they can actually know if they can help you with maybe donor sperms or donor eggs, IVF and the rest of the options that are available. So it's very necessary that you know where the problem is, and this is not the time to be in denial, because if you really, really want an answer, two parties involved in thorough investigation.
But let's look at the cause of it. What can cause this, really?
Well, for some men, they are born with some genetic abnormalities, some chromosomal abnormalities that affects them at puberty, that affects the testicles from developing normally as it should. So there's something called karyotyping. When you do karyotyping, you check whether at the chromosomal level, the person is fully chromosomally a male and is developing normally as a male. You will know that the pubertal developments will follow the normal route it's supposed to follow. But when there are some chromosomal abnormalities in such males, even at puberty, they will not develop normally, they will not develop the secondary sexual characteristics, and in some cases they may even develop normally, but you still find out that they were exposed to certain things in their developmental years that affected the development of the testicles, because the stem cells are produced in the testicles, and if anything also affects the hormonal axis that connects the pituitary glands to the gonads, or reproductive, like the testes, for instance. You have such hormonal imbalances and hormonal feedback mechanism problems. You may also find out that the patient would not develop normally, and when he gets to puberty, his testicles are not going to be producing sperms the way it's supposed to. And then you find out that at the end of the day, these are the kind of people that when it's now time for them to get married or have children, they start having problems. And when these problems start, especially in our environment, nobody looks at the man first. Everybody always looks at the woman. We are not saying that women are completely free from these things. We know women have also the female causes. But for a man, basically, it's usually chromosomal issues, developmental problems, infections, and improperly treated infections, varicocele, or any other thing that affects the development of the testicles. And then there's something called testicular torsion too in men. Testicular torsion is something that occludes blood flow to the testicles, can make the testes go gangrenous, and when the testicles are gangrenous, they're not getting enough blood supply. Of course, it can die out and it's not going to produce viable sperm like it's expected to. But usually, the testicular torsion usually affects one testicle at a time, but you never just know. You can't tell.
There was a time I asked you if both testicles should be of same size.
Ideally, they are not the same size. One can really be a bit larger than the other, and then sometimes in alignments, one may seem higher than the other. That's absolutely fine. What would actually diagnose if there's a problem is if there's an obvious swelling of the testicle, there's pain in the testicle, you go for a scrotal scan, and then you notice that maybe varicoceles are present, maybe microliths or tiny stones are present, or what we call a hydrocele, a fluid collection around testicles are present. Those are the things that can actually signal that there's a problem around testicle. But basically, nobody can actually do a thorough examination by themselves and tell for sure that, okay, this is why this person is not fertile. You need a professional to guide you to know what you're supposed to do. But men too also do have testicular tumors sometimes. So it's advisable that men too, do some palpation to feel for anything abnormal in the testicle, and if you notice any lump or any hardness or any areas in the testicle that does not feel usual, that feels different and is suspicious, you should let your health professional know and it should be investigated.
Okay. Someone asked a question. Because of our time, I just have to. There's a lot of questions I would have asked you as regards infertility in men, and then before I delve into women. But glory be to God, we will just pinch on this topic a little today, all right, and then next week Thursday we'll delve deep into it if we have enough time again. Now, but then let me quickly delve into, because of those listening, they have several other questions. You know how we do it. So let's look at some of these questions. Someone is asking quickly, please ask the doctor how to treat arthritis. The best way to treat arthritis, please.
Arthritis can be in two forms. You have what we call rheumatoid arthritis, which has to do with the body's immune system building antibodies against the joints and damaging the joints. And you have osteoarthritis that comes with, of course, wear and tear that comes with aging. So basically, when there is arthritis, it simply puts inflammation of the joint, and the joint is a place where two or more bones meet. Okay. So when you have those inflammatory conditions, you find out that there's pain, there's warmth, there's swelling, there can be redness over the area for people who are light skinned, and then you can also find out that there may be something called crepitus. You are hearing clicking sounds when you are climbing the stairs, or when you are taking a walk, you are hearing some creaky sounds. All those are showing that bones are actually grinding against the other. The synovial fluid that should lubricate the joints may be drying up, and the structures that hold the joints in place may be wearing out. So basically, for most people, if you know you are overweight, lose weight. That's the first thing. If you know you are overweight, please work on your weight. If you know that there's a family history, then you should make sure that you start taking cognizance of all the things that are relating to arthritis. Don't take any pain in your joints, especially the weight-bearing parts of your body like the knees, for granted. Then secondly, you should try as much as possible to be on some supplements that help to renew the joints. There are some good supplements that are available. I may not be able to mention their names, but they are available to help you maintain lubrication, maintain balance, and maintain the supporting structures of your knee, for instance, so that you don't feel the progression of the inflammation will be slowed down, and ultimately your symptoms will be improved. Then you may also need to be on some anti-inflammatories. Some anti-inflammatories work excellently well. You cannot overrule the part of physiotherapy. Physiotherapy too is very helpful, because you can't just rely on medications indefinitely. And then also, for some people, depending on the grade of the arthritis, if it's advanced and very progressed and the joints are really, really damaged, ultimately the final solution to it would be a total knee replacement or hip replacement, as the case may be. So you need to see an orthopedic doctor. You'll be sent for an x-ray, or in some cases you may be sent for an MRI, to have a very good idea of what is happening in those joints. And then you seeing either an orthopedic doctor or a physiotherapist too would help you to a large extent to alleviate your pain.
We're talking about breasts, and someone sent a question, though there are some other questions that follows, but I think I want to treat just the first one. What happens when there is a pain around the nipple area? Just the nipple, not the breast itself. That's the nipple area. That's what the person is asking. He said one of the breasts around the nipple is paining her, something.
And sometimes you can have cracked nipples. Sometimes you can have the nipple, being a bit tender and painful, especially for women who are lactating. And then this can be a source of problem for them, especially when they are breastfeeding their babies. So if this kind of problem...
If you're not breastfeeding babies, okay?
If you're not breastfeeding babies, you can also have different conditions like, inflamed nipples that can happen, cracked nipples, it can happen. You have a condition called mastitis, where there is actually inflammation of the breast tissue. So when that happens, you need to go for a breast scan, and then we need to know details of the nipples to see that there is no nipple retraction. The nipple is not actually going back inwards, because it's supposed to be pointed outwards. So because if it's going inwards, then that tells us something. That's a red flag, and maybe pointing to something more serious. So
what can that be?
No, you can. Nipple retraction is a well documented symptom of breast cancer. So it's something to watch out for. So it's very important that if you're having any pain around your nipples, you should examine it properly. If you have cracks there, you can apply some emollients or some moisturizers there to help to at least heal the skin, so that the drying or the scaliness of the nipple may improve. And then ultimately, if the symptoms persist, of course you have to go to the hospital to investigate further. And then please always watch out for any abnormal nipple discharge. Any discharge from your nipple that is either milky or bloody or whatever color it is, please let your doctors know. If you are not lactating, if you are not having a baby and you are discharging anything from your nipple, please get it investigated. It may be a very good, important information. And please don't hide anything from your doctors. Always be as open as possible, because your doctor can only work with the information you've given them. They don't live with you. They don't know what you're really experiencing. It is to the extent you open up, that's the extent they can help you out.
What are the recommended management strategies for hypertension in pregnancy? Someone is asking.
That's a very good question. Very, very good. And I'm glad somebody asked this question, because we've spoken about hypertension several times, the silent killer. There are different classes of drugs that you use for hypertension. We're always telling people, use your BP drugs, cut down salt and all that. But when you are pregnant, it's a different ball game, because some of the BP medications that you were taking before you were pregnant may not be suitable in pregnancy, because now that you're pregnant, you are considering not only your health but also the safety of the unborn child. So it's very necessary that you know all the classes of drugs that are safe in pregnancy. Anyway, it is not for you, who is not a medical professional, to know the details of those medications, but it's good enough for you to know that, please, if you are pregnant and you ever hear that your BP is high, never assume that the drugs you were taking before or another person's BP drugs is suitable for you. Not every drug, not every antihypertensive is safe in pregnancy. You have a few classes, classes of them that are safe. We can mention the methyl dopa, that's safe in pregnancy, the nifedipine, that is safe in pregnancy, labetalol, safe in pregnancy. All those are drugs that we normally give in pregnancy. But all the other regular drugs that most people take outside of pregnancy, they are okay to be taking them. But the moment you're pregnant, you will notice all the drugs that you would ever see your doctors give you will be in the line of nifedipine, labetalol, methyl dopa. Those are all the classes of drugs to be given. And if you are to be given anything intravenously, it will probably be hydralazine. So you can't usually go outside of those. Those are the safe drugs that we know, tested and trusted.
Okay.
They've been safe and not causing any developmental problems in the unborn child, because while you're trying to treat something, you should consider the development of the child, because any drugs that the child is exposed to in utero can potentially affect the normal development.
Now, back to breast cancer, someone is asking. So why is it that some women end up having breast cancer even when it does not run in their family?
Yeah. We mentioned genetics as one of the important factors, but genetics alone would not account for the manifestation of breast cancer. For some people, their lifestyle and their diet, plays a crucial role. Their environment, occupational hazards, the thing they get exposed to. Cancer is something that is it's been around for a while, but it's still evolving in terms of identifying the true cause, and then knowing how to manage it effectively, because work is still ongoing, globally about cancer. Nobody can beat their chest to say that, okay, we have actually trapped cancer. We know what it's all about and we can handle it. So it's something that is still evolving. Medicine is dynamic. More research is going on. Clinical trials are going on. But we know that other factors that are attributable to it include chemicals, carcinogens, the kind of diet you eat, hormonal causes, use of contraceptives. You just can't afford to do things on your own. Nowadays we advocate for people to go all natural as much as possible, stay away from processed foods as much as possible, stay away from preservatives, stay away from food additives, artificial colorings in foods, stay away from a lot of artificial things that we use even for our skincare products. We should be as natural as possible, and we should try as much as possible to ensure that anything that increases our risk or chances, even exposure to radiation in our environment or in our workplaces too, we must take all those things seriously, because those are the potential carcinogens that ultimately result in cancer.
It said, does sugar cause breast cancer? One expert, according to her, one health expert was saying that when you take too much, or too much of sugar or too much sugary items, you can develop breast cancer. Is that true?
I would not say that is true because sugar in itself would not cause breast cancer in particular. Sugar can be pro-inflammatory. Sugar can make you, put you at risk of other health problems. But basically, breast cancer and most cancers have a genetic basis in most cases, and then there are other attributable factors like I've mentioned, processed foods and all that. But sugars in particular can encourage the growth of cancer if you already do have cancer. So when you have cancer, you don't want to be binging on sugar and sugary things. Your diet will change, your lifestyle will change, everything around you is going to change, and it will be better for you to go all natural. But sugar in itself causing breast cancer in particular is not a documented fact.
My question is, if a woman have an issue like hormonal imbalance, which make her not know when she is ovulating, please, how can she treat it in order for her to conceive?
Well, it's important that if a woman wants to conceive, she needs to go for a
She said, I need this question to be answered because I'm dying in silence since I got married.
It's very important that you go for a full hormonal workup, a full hormonal profile, because when you go for a hormonal profile, all the necessary hormones that control your menstrual cycle and your ovulation is going to be checked out. You'll go for relevant imagings and scans that will help us assess, your ovaries. And then there's something called folliculometry. Folliculometry will help us track, your egg development, and then watching you towards when you are expected to ovulate to see whether the follicles are actually developing and growing, ahead of discharging a fertile egg, for fertilization. So it's very important that you go for these important investigations. And then it's also necessary for you to go for what we call the HSG to notice if your the patency of your fallopian tubes, because that is also very important for fertilization to occur. So basically, I'll just do a quick wrap up. You need to do your HSG. You need to do a full hormonal profile. You need to make sure that you go for relevant scans and investigations. And then folliculometry or follicular tracking can be done to help you know if you're actually ovulating or not, because some women actually do have what we call anovulatory cycles. They have their normal cycles, but they are not ovulating. And if it is confirmed from the tracking or from this investigation that you're actually not ovulating, your doctor will have to place you on some drugs that can induce ovulation and increase your chances of conception.
All right, I used to have erection, but my penis just started to curve downwards as against the straight erection. What is the cause? And what can I do to regain straight erection?
Well, there's something we call Peyronie's disease. Peyronie's disease is usually characterized by, a change in curvature of the penis, and then you can also have scars or fibrotic plaques, within the penis that would make the penis change shape, so to say. So I hope you're not having Peyronie's disease. Peyronie is spelled Peyronie. So Peyronie's disease, that's what it's called. So you can read up about it. If it describes or suggests what you're experiencing, I think you need to go and see a general surgeon or a urologist to have you examined, and then they would find out if that is what you truly have, because they will also do some imaging for you to actually find out if you're having some change in the curvature of the penis resulting in this observation you just mentioned.
What is the best way to treat glaucoma and cataract?
Well, cataract
is it treatable in the first place?
Yes. Cataract is cloudiness of the lens of the eye. The lens of the eye is supposed to be clear, allowing light to, pass to the retina and all that. So if there's cloudiness that comes with aging or with diabetes or use of steroids or other medications, cataract results. So when you look at the person's eye, you see something whitish, like it's covering that black part of the eye. So that's typically cataract, and we see it in people who are elderly. But sometimes some babies are born with cataract when their mother has rubella infection, for instance. So when there is cataract, the only documented and reliable treatment is a surgery, which is cataract removal. It's a safe procedure that is done by proper professionals. So you go and see your ophthalmologist. They check you and confirm that it's cataract you have. They allow it mature or place you on some things, give you appointments, and tell you when to actually get it removed. And once you remove it, your vision is restored significantly. For glaucoma, glaucoma has to do with increased pressure in the eye, intraocular pressure. Just like you have your blood pressure, you also have the eye pressure. So the eye pressure should never be more than 21 millimeters of mercury. When you're having high eye pressure, you have glaucoma. And glaucoma can present with a headache, can present with redness of the eye, and ultimately it's a vision stealer. So for people that have glaucoma, they can actually lose their vision very, very quickly. So it's important that family history is observed. If you know that somebody has lost their vision in your family, or you have a number of relatives that have visual problems, and you're beginning to have eye pain, headache, and all that redness of the eye, please go and check the pressure in your eyes. And if you are told that it is high, they will start you on some eye drops that will help you lower the pressure. And ultimately, if anything needs to be done beyond that, the ophthalmologist will advise you accordingly.
Olufemi from Unilag sent this message. I'll treat this one as the last one. He sent 3 messages. I think he treated the first one that day. I think this was always stopped. The link between GMO foods and preservatives and cancer. You remember that question? And all of, I think you answered this question, right? Did. And then the question is the other one. He said, is it all family planning method that could cause breast cancer, or it's only tablets?
And the hormonal ones, we are more particular about the hormonal ones, the ones that can change your hormones, disrupt your hormones, estrogen containing ones. We are concerned about the estrogen and progesterone containing ones. Those are the ones that are most likely linked to that. But for instance, if you do what we call bilateral tubal ligation, which is you tying up your tubes that people call, that has no risk. And that's almost like a permanent type of contraception. So you're not going to have anything relating to cancer. But most cancer related issues are the hormonal treatments that we're very concerned about. So that's why before you actually embark on any type of family planning method, it is not your own decision alone to take, though it's your choice, to plan your family, but you also need the guidance of a professional who will, based on your history and your peculiar situation, and then your family history also, or maybe any underlying conditions you have, determine what is most suitable for you.
All right. The last one here is, are there no research outcomes that support herbs for cancer treatment?
Well, that's a good question, but like we always say, unless you have enough clinical trials, unless you have enough proven evidence that these things work, no doctor is going to actually embark on such treatments, because the truth is you need to be sure that whatever you're giving to your patient is not going to cause more harm to the patient, because one of the ethics of our profession is to cause no harm to the patient. So if you know you cannot help somebody, it's better you leave the person the way he is than for you to cause more harm for him, more than what he's already going through. So you are to alleviate suffering, not to compound it. So every single natural herbal remedy that there is, I think more research should be done on them. More proven evidences should be made available, because this evidence-based medicine, this is science. If you are able to prove that you have treated people with this condition and this is the outcome, so out of this number of people you treated, this is the outcome you got, this is your percentage success rate, then we are able to look at it and then now see, talk about the safety and the toxicity, because we are not looking only at the beneficial effect also, because you always look at the pros and cons of everything. You want to make sure that in as much as this thing is treating you, is it not also killing you in another way? So the safety and toxicity is important, and then we want to know whether it is actually safer and better than what currently obtains for current treatment. These are all the things that over time we observe in the clinical trials, and this takes years and years for us to actually verify these claims before we actually say it's safe for human use or consumption.
All right. We have to go now, but before we go, for all the questions I could not treat, or sometimes we don't like mentioning names of drugs here because they did not pay for advert, okay? And so that's why I also ask people to come here. Let's do this show together. If you you do something health related, just come around. Let's have a synergy. You could advertise your products here, your goods here. Yes, and I tell you, there are thousands of persons listening to this show right now. So if you have what do we call now, a pharmacy, or you produce drugs, or you have a laboratory or a hospital or
a clinic,
yeah, all of this, you could just come around, all right? just go check up Ikami Jude on all socials. Ikami Jude is spelled IKAMIJUDEH. That's my handle on either Facebook, WhatsApp, TikTok, YouTube, everywhere. It's just IKAMIJUDEH. It's just one word. IKAMIJUDEH. All right. And we've expanded all of these things we're doing here in the studio. We're taking it even outside. All right. The other day we were discussing that there's so many information people really need to get. Your family, your society, your community, your estate, your church, your
schools,
okay,
your community at large, because they are very, very important information that helps to create awareness about health. And we are more, keen on preventive health, because we don't want you to have the problem and be looking for solutions. So what are the things we can do to prevent those things from happening in the
even
first
coming
place?
at all?
Yes, so that's what preventive care is all about, because medicine is now shifting more to the preventive axis than the curative axis, because the curative axis is too expensive. Is the probability of you making it or not is there, because if it's already advanced, the doctors can only try their best. But what can you do to stay healthy and maintain your health?
We have to go now. Doctors Health on social media. Our time is really fast spent. Oh my God. Doctors Health.
Mike.
Yeah, Doctors Mike on social media. Oh Jesus. Doctors Mike on Instagram. Doctors Mike on Facebook. You can go there and ask any question you want to ask. There are doctors there waiting to respond to you. My name is Jude, Ikami Jude. I'm out of here. Good morning to you. Up next is news at 12.